Individuals suffering from paranoid personality disorder endure a form of paranoia that is so profound and intense that it's considered detached from reality by experts. This disorder manifests as an excessive suspicion and mistrust of others. Those with PPD often harbor deep-seated beliefs that others are constantly plotting against them, suspect infidelity without basis, or fear that their own words will be used to betray them. They are constantly watching their backs, whether there's danger or not. This leads to a heightened sense of distrust, making them hesitant to divulge information or partake in social exchanges. Consider the portrayal in the film The Aviator, where Leonardo DiCaprio's character exhibits this disorder. His struggle with obsessive compulsive disorder intensifies, giving way to severe paranoia and a series of unconventional behaviors. The roots of PPD can vary, ranging from traumatic experiences to early onset in childhood. Signs to look out for include a pronounced preference for being alone, unpredictable thoughts and actions, and an excessive sensitivity to criticism. A significant challenge with PPD is the barrier it creates in seeking help, as individuals may be skeptical about the benefits of psychotherapy or doubts the integrity of the therapist. Despite these hurdles, therapy is generally recognized as the most effective approach in treating PPD. Number 2. Schizoid personality disorder. Schizoid personality disorder is a condition that is often misunderstood and often mislabeled, particularly due to its superficial similarities to more well-known disorders like schizophrenia. Crucially, SPD is characterized by a lack of interest in social relationships, a tendency towards solitary or sheltered lifestyles, and limited emotional expression in interpersonal settings. Unlike schizophrenia, SPD does not involve the psychotic symptoms like hallucinations or delusions. Individuals with SPD typically function pretty well in everyday life, maintaining employment and routine activities, but they usually do so with a marked disinterest in forming personal relationships or engaging in social activities. This detachment from social and emotional experiences is a core aspect of this disorder. In terms of public figures or characters who might exhibit traits of SPD, one can actually look to Sherlock Holmes, the fictional detective created by Sir Arthur Conan Doyle. Holmes is often portrayed as highly intelligent and observant, but also as markedly aloof and uninterested in forming close personal relationships, aside from a few exceptions like his friendship with Dr. Watson. Another example is Dr. Gregory House from the television series MD. House is a brilliant diagnostician who often displays a lack of interest in social relationships and a preference for emotional detachment, characteristics that align with SPD traits. Some historical accounts suggest that figures like Isaac Newton might have exhibited traits consistent with schizoid personality disorder, given his repeatedly reclusive nature and focus on his work to the exclusion of social interactions. It's important to note that while these examples provide a glimpse into how SPD traits might manifest, they are by no means definitive diagnoses. It's crucial to recognize that schizotypal personality disorder is distinct from both schizophrenia and schizoid personality disorder. The hallmark of schizotypal personality disorder is its association with eccentric beliefs or imaginative fantasies. Individuals with this disorder often hold intense, unconventional ideas such as elaborate theories about other dimensions or extraterrestrial life, which can alienate them from mainstream society. A notable example from pop culture is Gene Wilder's portrayal of Willy Wonka. His creation of a fantastical candy universe and his peculiar manner of speaking are very indicative of traits associated with schizotypal personality disorder. Additionally, Willy Wonka's long-term self-isolation within his own fantastical world aligns with this disorder's traits. Paranoia is actually a common symptom in those with schizotypal personality disorder, particularly when their beliefs are unconventional or unsettling. Reflect on Willy Wonka's fears and his protective attitude towards his confectionery inventions. And while there are many connections between schizotypal personality disorder and a family history of schizophrenia, identifying this link can be challenging. Without this awareness, individuals with schizotypal personality disorder often find it really hard to seek assistance and build meaningful relationships with others. Number 4. Antisocial personality disorder. Antisocial personality disorder might misleadingly suggest a preference for isolation or an aversion to social interaction, but in reality, antisocial personality disorder is typified by a flagrant disregard for others' rights, often exhibited through impulsive, deceptive, or even unlawful behavior. Consider the portrayal of Christian Bale's character in American Psycho as a heightened, though extreme, example of this disorder. Experts have noted that this character not only exhibits antisocial personality disorder, but also shows traits of borderline and schizotypal personality disorders. Historical figures like Ted Bundy have exhibited traits consistent with APD. Bundy was notorious for his charm, his intellect, traits often associated with psychopathy, a severe form of APD. He manipulated and he deceived many, showing zero remorse for his actions. Another example from a film is Alex DeLarge from A Clockwork Orange. This character displays classic signs of APD, including a lack of remorse, violent behavior, and manipulative tendencies. In television, Tony Soprano from The Sopranos is often discussed in the context of APD. He's a character who, despite being a family man, shows many signs of the disorder, such as manipulating others for personal gain and exhibiting violent behavior. It's crucial to note that APD exists on a spectrum. Not everyone with the disorder engages in extreme or criminal activities. Some individuals might simply struggle with empathy and exhibit more subtle forms of manipulative behavior. The most severe cases, often labeled as psychopathic, are characterized by a complete lack of empathy, aggressive behavior, and a persistent pattern of deceit. These individuals often cause significant harm to others without any sense of guilt or remorse. Narcissistic personality disorder shares certain traits with antisocial personality disorder, notably a blatant indifference to the feeling of others. However, this lack of empathy in narcissistic individuals is often coupled with an exaggerated sense of self-importance. Narcissists typically view themselves as just exceptional and deserving of special treatment. This self-inflated perception drives their manipulative behaviors and even unlawful actions to achieve their desires. They often indulge in grandiose fantasies and are incessant in their need for admiration. Narcissistic personality disorder can be a significant barrier to forming meaningful relationships. Notably, various prominent figures have been speculated to exhibit signs of narcissistic personality disorder. Fictional characters such as Gordon Gekko from Wall Street embody the traits of NPD. Gekko's famous line, "Greed, for lack of a better word, is good," reflects the self-centeredness and sense of superiority typical of NPD. In addition to Donald Trump, who is frequently cited in discussions about NPD, some have suggested that Steve Jobs, co-founder of Apple, displayed characteristics consistent with narcissistic personality traits. His visionary zeal, coupled with reports of his demanding and sometimes ruthless interpersonal style, align with some aspects of NPD. NPD can lead to significant challenges in personal and professional relationships, and not everyone with narcissistic traits meets the criteria for a diagnosis of narcissistic personality disorder. Individuals with this disorder, much like narcissists, often exhibit an intense craving for attention. These individuals are typically seen as the soul of social gatherings, exuding charm and extroversion. However, their seemingly outgoing nature is deeply rooted in an unrelenting need for approval and affirmation. HPD manifests in behaviors that are emotionally charged and often sexually provocative. When their thirst for recognition and validation goes unquenched, individuals with HPD might react with extreme emotionality or theatrical antics. This disorder also leads individuals to perceive their relationships as deeper and more intimate than they actually are. A notable fictional representation of HPD is Michael Scott from The Office, whose behaviors align with many characteristics of this disorder. BPD shares some traits with paranoid personality disorder, but it is predominantly marked by volatile mood swings and unpredictable behavior. Individuals with BPD might engage in hazardous behaviors or show heightened aggression towards others. Various film characters exemplify BPD traits, such as Clementine in Eternal Sunshine of the Spotless Mind and Tiffany in Silver Linings Playbook. Additionally, the memoir Girl Interrupted provides a real-life perspective of BPD, chronicling the author's time in a psychiatric facility following her diagnosis. Often, BPD is mistakenly associated with or compared to bipolar disorder, a mood disorder characterized by extreme episodes of mania and depression. While mood fluctuations are a component of BPD, the disorder primarily revolves around and adversely impacts interpersonal relationships. Individuals with this condition are intensely preoccupied with how others perceive them. Unlike those who seek affirmation through extroverted behavior, these avoidant personality disorder folks tend to withdraw from social situations. Their aversion to risk and exposure is driven by a deep-seated fear of rejection or humiliation. This condition goes beyond just shyness. It's an anxiety that can lead to complete social isolation and persistent fearfulness. A familiar, albeit fictional example actually is Elsa from Frozen. The trauma stemming from her magical abilities caused her to isolate herself for years, driven by the fear of being misunderstood or causing harm. Obsessive compulsive personality disorder is often confused with obsessive compulsive disorder. These are distinct conditions, We probably need a better naming system, but here we are. OCPD is primarily marked by an overwhelming need for perfection, orderliness, and control. Individuals with OCPD adhere strictly to rules and standards, often to the detriment of flexibility and efficiency. Their preoccupation with details, rules, lists, and organization can significantly impair their ability to complete tasks and maintain relationships. Unlike OCD, which involves uncontrollable repetitive behaviors or mental acts, like hand-washing, counting, checking, all that, OCPD does not typically include these compulsions. Instead, people with OCPD have a chronic, pervasive pattern of perfectionism and control that pervades their overall functioning and interpersonal interactions. In popular culture, a character often cited as displaying traits of OCPD is Monica Geller from the TV show Friends. Her obsession with cleanliness, order, and rules, along with her difficulty in dealing with changes or disruptions to her system, are characteristic of OCPD. In film, another example might be the character of Mark Zuckerberg, as portrayed by The Social Network. His intense focus, strict adherence to his own set of rules, and difficulties in interpersonal relationships could be interpreted as signs of OCPD. It's important to recognize that these examples from movies and TV shows often exaggerate or simplify complex behaviors for dramatic effect. In real life, OCPD is a nuanced disorder that can vary significantly from person to person. In childhood, it's typical to encounter separation anxiety, a fear of being alone even. However, when these anxieties persist into adulthood and are not resolved, dependent personality disorder can develop. Individuals with this disorder exhibit an overwhelming reliance on others, to the extent that making even the simplest decisions becomes a challenge without external guidance and affirmation. Their dependence is so pronounced that everyday activities and decisions such as choosing what to wear or where to live become daunting tasks requiring constant validation from others. To illustrate, consider the character Cinderella, who, through a whimsical example, has been suggested by some analysts to demonstrate traits of dependent personality disorder, constantly seeking advice from her animal friends and fairy godmother. Remember that having a personality disorder is not a matter of embarrassment. Both fictional characters and real individuals with these symptoms can lead fulfilling lives. However, if left unaddressed, certain disorders can lead to detrimental behaviors. It's important to reflect. Do you or someone that you know exhibit any of these symptoms? If so, consulting a therapist might be a good step. Talk therapy has been very effective, has proven to be highly effective in treating personality disorders. Just talk therapy. Though medication may offer varying degrees of help depending on the specific disorder. But if you suspect you might have a personality disorder, reaching out to a healthcare professional is a recommended course of action, goes without saying. And if you found this video engaging, I encourage you to like the video and subscribe to the channel for more educational content and informative videos. I certainly hope this video was both enjoyable for you. I'm talking funny. Thanks a lot for your time and your attention. Later.